Welcome, everyone. Uh, my name is Elaine Keesley, and I want to thank Jillian and Your Life of Coconut Creek for having me here today. You will see me referencing notes every once in a while, so please know that I'm not looking away from the audience. It's just I want to make sure I'm prepared for each of you that have joined us today. And this is a new meeting style for me in our new normal. I have worked with loved ones of patients with Alzheimer's disease and other related dementias for years, partly in honor of my grandmother and the day she tried to eat stems of the fresh flowers in the vase for lunch. My mom and I looked at each other and said, "Oh, this is a problem." I'm also here today for each of you present. As caregivers, loved ones, and friends, when someone's lungs or heart don't work perfectly, we question them. But when someone's mind starts to not work, it often baffles us. And the word remember, when stated to an individual with dementia, it falls on deaf ears because they simply can't. They're not wanting to ignore us. They love us as much as we love them. It's the disease process, and it's not them. Again, like I said, my name's Elaine Keesling. I have been blessed to have been called into hospice 13 years ago. I started as a volunteer, and the past 10 years as a patient advocate, and now as a nurse. And what I want to present today is Namaste and how this is specialized hospice care for patients with advanced dementia. And not only does it impact the patients, our loved ones, our friends, our partners, Namaste Care has the potential to impact each of you that are here with us today. And I'll describe that and discuss it a bit. And I'll have my name and information how to contact me at the end of the presentation, and I can answer questions. Again, it's our new normal, so this is a recorded presentation, but we'll make it work. We'll figure it out. And Jillian has my contact information as well. So with the objectives of really having this heart-to-heart conversation with you today is defining dementia. Discuss goals associated with the Namaste Care. For some of you, this may be the first time you're hearing this term. For others of you, you're aware of it. And so this is a blended group, and we'll all take this discussion together and understand techniques used when providing Namaste Care. That is really what I want you to have as tools when you leave this presentation today. And what is dementia? It is the irreversible loss of cognitive function. It cannot come back. And the diagnosis is based on clinical tests and findings. What I find very important about the photo that's on the screen now is the tree on the right with the red leaves really shows the change in the loved one or patient's brain. They can't help it. It is as if their computer no longer works. They are doing the best they can. And when each of us can support them and help them with doing the best they can every day and understanding their diagnosis and that it's a progressive disease, each of us comes away stronger. And you may be here today for a loved one, you may be here today as a friend, and you just don't know when this information might be useful to someone that you have yet to meet. Again, I thank each of you for being here today. There are different types of dementia. Often you'll hear of Alzheimer's disease, but you'll also hear of related dementias because the diagnosis occurs after death with an autopsy. So a lot of the diagnosis in the forefront is based on signs and symptoms that the patient is exhibiting, or your loved one, or the resident at a memory care facility such as Your Life of Coconut Creek. And Alzheimer's disease is caused by damage to the brain cells that lead to cell death. And that's where that tree that we just saw on the previous slide really depicts those cells dying and the brain changing. The frontotemporal dementia, it's caused by degeneration of the frontal and temporal lobes that are located at this part of your head. And this is often the diagnosis in younger patients. They are often still working and in their 50s. So these are how the changes occur. And then Lewy body dementia is caused by abnormal deposits of protein, which is the alpha-synuclein, inside the brain's nerve cells. many, many different types of dementias, and most likely more to be discovered. With the dementia stages, and I highlighted some different words here so that each of you may be able to associate with where your loved one might be, where a friend may be, even on your journey of wanting more information. For mild cognitive decline, that is recent memory loss, difficulty with word finding, organizing, working, some lack of judgment, and possibly depression. In moments of clarity, individuals with early stage dementia, they know something's changing and it frightens them. Since birth, they've had a beautiful dash in their life of career, possibly accomplishments, children, and when they find the car keys in the freezer, the handbag possibly is in the office where they don't store it. In those moments of clarity, it's frightening, and it's good to understand that. In the middle stage of dementia, there's reduced memory of personal history, difficulty planning events and paying bills. The individual may seem subdued or withdrawn or disoriented to place, time, and again, that depression sets in. And often these individuals don't want to tell their family that they are having these challenges. Power may be shut off. Something else may occur at the house that a family member notices this. The individual doesn't often willingly want to share this information. And in late stage, look at the word depression again. So we're seeing that word in each of the different stages. The patient can no longer speak. There's groaning, teeth clenching, they're withdrawn, increased confusion and agitation. And mind you, this agitation and confusion is the diagnosis. It's not caused by each of you here today. It's part of the disease process. The special care goals for individuals with dementia, and this is what Namaste is really about, is promotion of sensory stimulation to evoke feelings of comfort. Let's make our loved ones or those we care for or residents in a memory care unit and community comfortable. Create a calm and relaxing environment. And so with Seasons Hospice, the hospice aides that do Namaste Care, which is built into the care plan, actually carry a tote with them, and it has lavender room spray, lavender essential oil to put into the diffuser, soft music is played, lotion is brought to do a hand massage or a shoulder massage. It depends on what each resident or loved one is comfortable with. And to bring back some of those memories is the Pond's cold cream for the ladies and the Old Spice for, aftershave for the gentlemen. Because again, often their memories from years ago are available, but not their short-term memory. And it's also person-centered care. This is approach personalized to each loved one or resident. Some don't like to be touched. During their dementia progression, that no longer is comfortable for them. And the goal is to not agitate them more. And also Namaste Care is to teach loved ones ways to interact with the person with advancing dementia and that new person or that new loved one with music, scents, reminders of the past, human touch, gentle hand holding, gentle massage. And that's where you're able to interact with a loved one and also find that calmness for yourself in an unknown situation. And it supports caregivers by enhancing the support team. So the Namaste educates loved ones, friends, family, caregivers in a community or a memory care facility. So everybody is starting to provide a different way of caring for the individual diagnosed with dementia. Often I would ask for questions or examples or concerns. I can't do that with you, so Jillian will help if there is any of that need for us. This is amazing. Respect for individuality. Everyone today attending is an individual. You know what you like, you know what you don't like. So even in the era of dementia and when there are changes to the cognition and to the brain, know them. Know that family and work history and be able to share that if your loved one moves to a memory care community. What is their nickname? What is their preferred name? What do they like to be called by that they might recognize the most in times of confusion? What are their hobbies to display for them or talk about or show that loved one or individual? What did they like as leisure activities to discuss with them? Reminisce with each of these individuals. Have a daily routine. Have last wishes. Now, I have had family members say to me, my loved one only wants to wear the blue pants and the light green blouse. And I have had family members buy 7 to 10 of those items so that individual gets to wear exactly what they want. It may not be you, it may not be me. A lot of the dementia can be tactile, so the individual might like the feeling of the fabric, how it sits on their body. So just ways to think outside the box to help our loved ones. And last wishes are difficult. I'm glad to be talking about them with you now. And that is, do they want to be buried? Do they want to be cremated? Reflect on maybe stories you've had with loved ones or neighbors when they've been talking about loss, and maybe what your loved ones shared at that time of what they saw their future as, and really discuss that with them. So a hard discussion we're having today, but for the right reasons. This respect for individuality is so important. I'm actually going to also read a letter at the end of this presentation, and it's written in the voice of someone with dementia. And this letter will tie into honoring individuals in the person with dementia. And you'll understand when we get there. It's very touching, very moving, and it really causes some reflection. Again, respect for individuality. Understand them. So often a lifestyle preferences appraisal identifies sensory preferences. This is completed by caregivers with the assistance of nurses, social workers, aides or certified nursing aides, and volunteers, and each of you as a loved one or caregiver, partner, spouse, sibling, can be involved in that. And this is the basis for care planning for all disciplines, and that is for the doctor, the nurses, the aides, any specialist that come in so that that individuality is respected. Your Life of Coconut Creek has 96 residents in their 4 neighborhoods. Each of those 96 individuals, they want that individuality. And understanding them is hard. So for Namaste Providing Care, everyone who visits a patient with dementia or a loved one, a resident, can and should provide Namaste Care. And that Namaste Care is promoting comfort, relaxation, and gentle touch, and it truly is all of our responsibilities. It can be described as a loving approach, caring for people, especially with advanced dementia. And that's what this talks on, that Namaste is providing care. You're greeting your loved one, the patient, resident at eye level, a warm smile, a soft voice. So if they're laying in bed like the woman we see on our screen, you might kneel down even lower than the nurse sits with her there, or come to the side of the bed where her gaze is or his gaze is, and then lower yourself so that they can easily, with their head in the position it's currently in, see you. And make that eye contact. Understand, is the individual hard of hearing? Do they like people to stay a little bit further away from them, or do they like that comfort of having somebody possibly sitting right at the side of the bed and holding their hand? And truly, Namaste Care benefits both the giver and the receiver. We talked about playing the calming music. It can be just something gentle in the background, again, for the caregiver and for the resident, patient, your loved one. Namaste Care is unrushed. It can be a bath in bed, and it's done a little slower. So what you'll often find with individuals with dementia is they won't want to take a shower, or they won't want to take a bath, or they won't want to take it at a time that's conventional for you or me. So it's finding out how to work with them and possibly slow down the motions of care. Ensure comfortable positioning, not rush it. soaking the hands and feet and adding that warm effect. It can be even a wet washcloth that you wrap around the hand or a tepid washcloth. Massaging with either a lavender lotion or an unscented lotion. I often recommend the unscented lotion just to make sure that there aren't any reactions, or not everyone likes scent. Gentle hair combing, gentle mouth care, actually providing love and care. So that's really important. You can see some of the different outcomes in the picture with this gentle approach and the care. There can be extra special touches, and this can be really individualized to each of you at this presentation today and to those you may care for. So in nature and in scents, there can be lavender, which is known for calming, eucalyptus, which is refreshing, lemon, orange, which add a pop of zest, similar to when we cut the fruit, lilac for soothing, fresh cut grass for reminiscing. You know, again, each person's an individual. We don't know what their career may have been or their likes. Evergreen, which is a very strong scent and maybe something you might use during the winter or fall months. I like this one, quilts or clothing from home, especially if somebody's very tactile. They may want their favorite blanket, just something that's very special to them. Soft, light materials. You can see here to interact with individuals, you can do bubbles, boas, stuffed animals. So think of starting that for both you and your loved one at home. When they're in these early stages of dementia, you're starting to see the changes and you're scared or confused, and they're scared or confused, and you can find some ways to really interact together while providing special care for each of you. And I really like the individual reminiscing, the last point. So often in total health, our hearing's the last to go, and you don't know when that person you're with will have that lucid moment or moments, and you're with them reminiscing about, oh my goodness, I've heard families joke or talk about holidays, or if they like cooking, family vacations that might have gone well or gone awry. So it's really up to you to be as creative as possible with your loved ones and individuals. What I've really highlighted here is for the patient, the Namaste positive outcomes are providing improved quality of life, especially at this time with the pandemic, and a lot of loved ones aren't able to visit their loved ones in memory care facilities. The staff is there taking care of them, their family away from home, and it's providing improved quality of life. It provides more comfort. It has the opportunity to provide relaxation. And then the family, it's improved communication if you are with your loved ones. It's improved satisfaction. And for the facility staff, there's collaboration and support for your loved one. There's calmer, more manageable patients. And again, I say it has the same effect on the provider, whether that's you, your family, your children, your grandchildren, or caregivers that are caring for your loved one. This really has an effect on both of them. In Namaste and in Hospice, and again with Seasons Hospice, we promise to enhance the quality of time by ensuring that neither pain or declining symptoms will diminish the character of a patient's remaining days, weeks, or months. And with our dementias, we often see where our patients will have a downturn. They might have a urinary tract infection, and you might hear it as referred to that they have altered mental status. You'll see those abbreviations as UTI or AMS for altered mental status. And you can have individuals with dementia, they go along at a certain way that you know them for months or years, and then a decline, and they might plateau again for months or years. So it's an ongoing, and at some point they often, especially in late dementia, have a quick decline that we don't always expect because we've learned to know them in each of these different chapters of their life. I really like this slide because it ties into the Namaste and what we're talking about today. We are born into a world of comfort as new babies accepted into this world with warmth and love, and it is our belief that we should all leave the world in the same way. And that means care and comfort, dignity and respect each and every day, to live the fullest for each and day until that individual takes their last breath comfortably, and hopefully with family, caregivers at bedside. When I talked to you about reading the letter in the voice of a patient and a loved one with dementia, this is it, and it's very touching. And please reflect as we read this, or you listen to it and read it together on the screen if you would like. Please consider and reconsider these concerns of mine. Everyone living with Alzheimer's disease is and will be, until the moment of their death, a whole and complete human being. Every day of my life, I will be, in my own mind, Richard. I am neither half full or half empty. I am Richard. I am not fading away. Will you always treat me as Richard? Or will there come a time when I am seen as Richard shall? I want and need to give and receive love. Even when I can't remember your name, will you please love me? And that is Alzheimer's from the inside out. The gentleman that wrote this is Richard Taylor. Such an impact. It really lets you self-focus on the struggle that our loved ones, and maybe one day we might go through if we are diagnosed with Alzheimer's or frontal dementia, and Alzheimer's related dementia. You know, each day is a gift for us in this meeting today. And I'm proud to work with Seasons. I am honored to be called into being able to not only meet with patients, but meet with their loved ones, their caregivers, their friends, especially with the dementias, meet with somebody a year and a half before they may need hospice. But I'm honored to give each person a plan and answer their questions when they have more of the ability to ask those questions, and when their family has the ability to listen to what their wishes are. I've included my information at the end of this presentation. Again, my name is Elaine Kiesling. I'm a registered nurse. My cell phone number, my direct Seasons number is 754-260-8520. I've included both my email address and www.seasons.org. There's a lot of videos for caregivers. Often my caregivers are not going to their doctor's appointments and not always taking their own care into current times because they are focused on being that caregiver. And it's important to care for yourself as well. I thank you so much for this opportunity. And again, it's a new environment, a pre-recorded presentation, but Your Life of Coconut Creek and Jillian will help me if there's any specific concerns, and I can call you or email you directly and continue our conversation then. Be well and with gratitude, Elaine.